Three people are dead after a mysterious illness broke out on a cruise ship in the Atlantic. Right now, 150 people on board don't know when or if they'll be allowed to set foot on land. So who's responsible for these passengers and who's supposed to help them? To talk through all of that, I am joined by Lawrence Gostin, Faculty Director of the O'Neill Institute for National and Global Health Law at Georgetown University in Washington. Thanks for making the time, Professor Gostin. But before we go into this conversation, let's go into what we know. Now, the MV Hondius is a Dutch-flagged expedition vessel, and right now it's anchored off the coast of Cape Verde, going nowhere. Now, the voyage started at the southern tip of Argentina, and somewhere along the way, passengers started getting sick, very sick. The suspected cause, Hantavirus, a rare rodent-borne disease with no cure. A Dutch passenger died on board. His body was taken off the ship at the British territory of St. Helena, along with that of his wife, who had also fallen sick and died shortly after. And then a few days later, a British passenger became critically ill and was evacuated at Ascension Island. He's currently in intensive care in South Africa. And then a third passenger, a German national, died on board. Now, the ship has since anchored off Praia, the capital of Cape Verde. And on Monday, Cape Verdean authorities made their position clear. No one gets off. They say they need to protect their own population. Here is how one of the passengers on board reacted to that news.
All we want right now is to feel safe, to have clarity, and to get home. So if you're seeing coverage about this, just remember that there are real people behind it, and that this isn't something happening somewhere far away. It's happening to us right now.
Professor Gostin, Cape Verde is a small island nation. Now, when they say they will not allow disembarkation, do they actually have the legal right to do that?
Yeah, I mean, you might remember, your viewers might remember that during COVID-19, there were a number of instances where people got sick on board a vessel, particularly one in Japan, but other places as well. And there was the same chaotic scenes where they would not allow people to disembark. As a result of that, but also other failures during COVID-19, the World Health Organization amended its international health regulations to cover these areas. What the regulations say, and it's a legally binding treaty, is that a port must allow passengers who are sick to disembark, and it can only fail to do that if it literally does not have the capacity to care for them. It can't just say, we're afraid for our own people, because frankly, there is no risk to the people of Cape Verde. What they can do, if they have no capacity, is to direct the ship to another port where there is the capacity. The nearest would be the Canary Islands, which has Spanish jurisdiction and very good health facilities. But what's happening now is unethical, it's unlawful, and it's dangerous.
Interesting. I'm just wondering, there are issues to do with also, I'm just wondering whose responsibility overall, because the vessel is flagged to a certain country, it's near another country. It has also come through a long way, because it's been 3 weeks since the first incident with the first passenger, the first Dutch passenger who died 3 weeks ago. Why is this Cape Verde's problem?
Well, it's a problem because that's where the ship is currently anchored. And this is a nation state they actually are a member of the World Health Organization and the international health regulations, so they are bound by it. And sovereign nations have the right to decide who will and who will not disembark a ship or some other carrier. Just like somebody who would fly into a country, they still have to pass to be allowed in the country. This is something that is governed by international law, the law of the seas, and the World Health Organization's international health regulations. The law is relatively clear. These people should either be able to disembark in the port that they're at, or if there literally is no capacity to take them, which I doubt, then they need to be escorted to a close-by port that can take them. There is a duty to rescue these passengers under both WHO treaty and under the law of the sea. But here's the rub, which is that there's no enforcement mechanism. WHO has no power to force the country to take them in, but it should be using the bully pulpit to really urge that, because they are bound by international law to do far more than they're doing. And the excuse that their population's at risk is also covered by the international health regulations. The claim of risk to your local population has to be based upon sound scientific evidence. And this is a rodent-borne disease. It's not a person-to-person transmitted disease. So there is no significant or risk to the population of this country.
I suppose the Cape Verdeans would be saying, for example, it's multiple islands that make up the state. So again, that reduces the area in terms of where they can allow people to come in. They have to consider things like if they need to quarantine this group, but like you're saying, it's not a person-to-person issue. But the fact is, it is affecting lots of these people. So there are measures that maybe they feel they can't handle if all these people from a cruise ship were supposed to land on their shores. So what should they do practically? And maybe they don't feel that they don't have the adequate means or support to cater for them.
Yeah. Yeah, they haven't said that, but that's a very reasonable argument. That country has it's got the ability to provide basic health care for passengers. And so some passengers should be allowed to disembark because they don't need intensive care. For others, then arrangements should be made urgently for them to be transported to the nearest port that would allow it. And it does have the capacity. Right. The closest would be the Canary Islands under Spanish jurisdiction, and also close, not quite as close, is Portugal. Both advanced health systems, fully capable of doing it. But these passengers, you could hear in the voice the fear in the passenger that was put out this message is one of genuine hopelessness and fear, and that's what the law and international law is designed to protect against. You know, we owe a duty of care to people that are stranded in the open seas.
In a case like this, let's say if we are talking about urgency, why doesn't the ship just sort of, if they realize they're not getting room in Cape Verde, why don't they just keep moving and go on to the next possible place, like the Canary Islands, like you've talked about?
They probably should or have. They're probably still hopeful that they can disembark in the port where they are. But if they've got the ability to navigate and they would want to get permission from Spanish authorities to do it, That's what I would recommend. But there are multiple failures here. There is really, this is a preventable problem because the ship itself is responsible under the international health regulations for rodent control, for disinfection, for segregation of passengers. Right now, we don't know who on board was exposed to mice or rat droppings or urine, or whether it's aerosolized. We need a rapid epidemiological investigation. And for people who are exposed, the incubation period can be 2 weeks, it can be even longer. They could be at serious risk because whether it's a pulmonary hantavirus or it's a renal hantavirus or hemorrhagic hantavirus, these people can be at grave risk. You can deteriorate very quickly, for example, when the virus starts to affect your lungs, and you need intensive care. So we're playing with fire here. This is really not the way to learn from COVID and to do better this time.
Yeah. On that note, you did mention how the international health regulations were rewritten after COVID, specifically to handle moments like this. So can you walk us through maybe what's supposed to happen, for example, from when a ship reports a disease outbreak to, all the way through, and where this case has departed from that sort of framework?
Yeah, and if I may, I can do that. I'll even take it back one stage further, if I may. Before the ship sails, it really needs to have a certificate of sanitation and rodent control. So there were failures right at the beginning, and it's a Dutch flagged vessel. So the responsibility there is to make sure that those legal requirements are met even before the ship leaves harbor. Once a disease is suspected or confirmed, the ship has the responsibility to provide adequate medical care, to immediately report the incident under the international health regulations to the World Health Organization. WHO has the responsibility to make recommendations to coordinate the response. And then they should be docking at the nearest port and allowing passengers to get the medical care that they need. And if that medical care can't be provided on board, which it can't in this case, then you need to be sending those individuals to capable medical facilities. And also there should be, as I say, considerable vigilance for a number of weeks in case they develop a case of hantavirus disease, which can quickly become lethal. And we've seen already 3 people dead, 1 person in intensive care, and there will be more, most likely.
So based on all this, what lessons, I know lessons have been learned from COVID, but what further lessons are we learning, or things you think need to be further enforced going forward?
Well, one thing is that countries have a responsibility to have what we call international health regulations, health system capacities. These are capacities to be able to handle conveyances, planes, trains, buses, and particularly ships. And so most countries in the world, or many countries, don't have these core required capacities. So you begin with that. Also, this is showing a glaring problem with compliance with the international health regulations and compliance with WHO directives. So we need to think about compliance, accountability, enforcement methods. And so there's, in one way, we've learned quite a lot from COVID, but in another way, I fear that we're really not any better off than we were then. And in some ways, we might be less better off because since that time, global solidarity has broken. The United States is withdrawn from the World Health Organization. COVID itself has become politicized. There's all kinds of false messages on social media. And also countries are brazenly saying, we want to protect our own people when there is no scientific evidence that these passengers pose any risk to the local population. But that happened during COVID, and it's still happening.
Lawrence Gostin, Professor of Global Health Law, thank you very much for giving us your insights.
My pleasure. Thank you for having me.
And so what do you think? Who do you think should be responsible for the cruise ship passengers? Let us know in the comments. I am Tomi Oladipo. Thanks for watching and see you again soon.